Hello and welcome to Physician Spotlights. I am your host, Dr. Jay Patel. Physician Spotlights is a forum to learn more about our outstanding physicians in the field of nutrition and to discuss important topics and ideas. With the help of ASPEN, we are bringing these videos to you. Our guest today is Dr. Nilesh Mehta. Dr. Mehta is a professor of anesthesiology at Harvard Medical School in Boston, Massachusetts. With over 20 years clinical and research experience, Dr. Mehta has made numerous contributions to advancing clinical nutrition. He founded and directs the Critical Care Nutrition Program at Boston Children's Hospital. His research focus is on identifying and implementing best nutrition practices in critically ill children. He's completed 3 large international studies of nutrient intake in over 3,000 mechanically ventilated children from over 15 countries and has demonstrated associations between nutrient delivery and outcomes. He has received numerous awards for his work, and as many of you know, he was the 42nd president of ASPEN from 2018 to 2019. Dr. Mehta, it is an honor to speak with you today. Thank you for joining me.
Thanks, Dr. Patel. Thank you for inviting me and thank you for doing this. This is such a valuable contribution, and I'm delighted and honored to be with you.
Thank you. Dr. Mehta, can you share with us a little bit about how you got started in clinical nutrition? What was the spark that kept things going for you?
Thanks for that question. You know, back when I started doing clinical medicine, I was always attracted to pediatrics, and pediatric critical care became my home. In the first 5 to 6 years of my practice, I realized um, at the bedside there was very little evidence base to drive practice related to nutrient delivery. It was becoming very evident in the 1990s that one of the key implementation or interventions for children is nutrition. But here we are in the sickest phase of their lives, and we had very little to go by in terms of evidence to guide our practice. So I was struck by this big gap in our understanding. I was also very fascinated by the impact of critical illness on a child's uh, metabolism, and based on some elegant work done over decades, almost a century, by so many previous investigators, we had begun to understand the metabolic stress response and the way critical illness impacts not just macronutrient but also micronutrient status in these patients. And then the last piece was there were observational studies and then some intervention studies which made it very clear that how we feed, it matters. There are clinically important outcomes that get affected. So putting all these three together, it became very clear to me that this is an area which is extremely exciting, which brings physiology, pathophysiology at the bedside, which has a huge gap in our understanding of what we need, and which probably deserves systematic investigation because it could be a low resource, it could be a simplistic intervention that could have implications for outcome change later on. So when all these things came together, I was naturally aligned to focus on clinical investigation initially, and then translational investigations in the field of um, critical care, nutrition, and metabolism.
No, that's very fascinating. Thank you for sharing that. You know, it always amazes me when I hear stories of clinicians who really at the bedside are identifying these very crucial, knowledge, but also research gaps. That being said, can you share with us a little bit about some of the questions you were asking very early in your career and some of your earliest projects?
Sure. As you know, Dr. Patel, many times you start at a very basic level. And when we were rounding in the ICUs, some of the very fundamental questions were unanswered. So to me, the ability to understand how much food, how much calories, how much energy to deliver to a child who's critically ill was such a simple question which remained unanswered. And the reason that was where I gravitated first is right then, the fascination of us intensivists in trying to look for understanding physiology at the bedside was almost deep, and the metabolic cart had been in action for a few decades. Um, so I tried to use the metabolic cart to try to illuminate some of the metabolic stress response. And some of my early work began by trying to understand metabolic stress response, and in particular, energy requirements in order to derive some form of guide for prescription for energy. I would add, while we were simultaneously doing that, the other thing that struck, and as you know, it strikes us even now, is the heterogeneity of approach. People just did such varying things. In fact, there were times when it depended on which team was on, is how the child got fed. It still is true in many cases in many parts of the world, and even here at home. It derives its heterogeneity from the lack of information and evidence, but at the same time, it's a self-fulfilling prophecy that because nobody comes together to do homogeneous stuff, we never understand what is good practice and what is not. So I did also try to simultaneously address how can I gather evidence together to come up with, at that time, with the scant literature available, what can I uh, come together, what can I put together as the best practice as we know it, to be fine-tuned as new research becomes evident. So while we were doing metabolic experiments, and we would then went beyond indirect calorimetry to understanding protein metabolism and looking at stable isotopes to understand how protein gets both synthesized and broken down, we also tried to gather folks together to come up with initial guidelines for ASPEN, which was now several years ago. So those were the three main areas where I got started.
Yeah, that's amazing. One thing you touched on a little bit was some of the challenges in doing research in this particular space. The heterogeneity, for example, and how everyone is sort of almost working not necessarily in silos, but it's hard to bring sort of people together in this space. Can you share with us some of your other challenges you had early in your career, and really who and how did you overcome who helped you and how did you overcome these particular
Yeah,
challenges?
it's a great question. When we talk about nutrition, the one thing why you and I love this area of investigation practice is the interdisciplinary nature. Nutrition, especially in the ICU where you and I work, is a team sport. You require uh, the patient and the family to buy into the concept. Luckily, most families in my world in pediatrics are very clued in about nutrition and its importance. You then require the physicians and the bedside providers, whether it's a trainee or the faculty, to come together. But the most critical piece for me is the bedside nursing, who are constantly facing the challenges of both evaluating readiness, but also delivering nutrient interventions, and then trying to document how the patient is responding to that. So the very first people that I approached and partnered with and learned a lot from and got a lot of support from was my bedside nurses. They became the drivers of some of the change that we affected. And because we practice a nurse-driven intervention on a day-to-day basis in the intensive care unit bedside, we have promoted and always adhered to a nursing-driven nutrient delivery strategy as well. So the nurses were my partners and some of the most important collaborators in the clinical work. But in addition to that, when you are trying to advance science, and especially when you are a junior faculty, you need a lot of support. And I was very fortunate to be surrounded by people who recognize the area, recognize that here's one person who's dedicating his time and efforts to illuminating this area of both clinical and research gaps. And both my supervisors and my bosses, but also my colleagues, were very, very supportive. And that helps. It really is very useful. And finally, we all need our mentors, and we are nobody if without the guidance and support of mentors who you recognize as people who have the credentials to help you in your pathway. And I was very blessed by having the mentorship of so many, Dr. Christopher Duggan, Dr. Tom Jaksic, and my immediate boss then, Dr. Jeffrey Burns, who has even as of today continued to support all three of them, my endeavors. And the last thing I'd say is when we work in silos, we can only achieve so much. So then to step out of your field and try to garner support from others. And I've over the years maintained a cadre of collaborators all over the world who we sound out each other for determining where we go next and try to do it together. So you mentioned the International Nutrition Study platform was developed mainly for that. We now have over 100 pediatric ICUs that participate in that, and that's where ASPEN fits in. So at a very early stage, I was looking for a home, and I found that all the stuff that I just mentioned to you, the interdisciplinary theme, the need for mentorship, the need for collaboration, all this came together in Aspen for me. So it was a perfect home. And I joined Aspen, and it has been such a fantastic platform to support everything that me and others have done in this field.
Yeah, no, that's phenomenal to hear. I think what many of us would appreciate, including myself, is sort of the interdisciplinary nature of the work, that you describe. And Aspen is certainly a home that fosters that interdisciplinary, nature of both, research, but also fulfilling knowledge gaps as well. So if I'm, say, a young investigator, and I am stepping foot in Aspen for the first time, or I'm thinking about stepping foot, in Aspen, what words of advice would you offer to someone like me or another, young investigator who maybe has no clue where to begin, but just has, a passion for making differences in clinical nutrition?
Great question. As you know, with your personal experience and mine, this is not an uncommon scenario. When we come in, we have no idea what's available and what's not. And I must give kudos to the organization. Over the years, they have recognized this need to help faculty when they are young, like us when we were. And and there is an immense structure in Aspen which is willing to reach out to young investigators and do one of two, three things. One is to recognize where you might need some support and help. So there is a mentorship program, and our in-person meetings is such a wonderful place for you to meet and greet people who might become your mentors. And one of our past presidents, Dr. Comfer, pioneered this effort that many others previously have started and since continued, which is to find young people when they come to Aspen meetings and connect them with senior mentors who may be in their field, may be complementary, but then take them under their wing and introduce them to the breadth of activities and potential opportunities in Aspen. The second thing I would say is sometimes you need to begin, and Aspen is an organization based on volunteerism. And the first thing you think about is look at the website, start looking at all the various aspects, the facets of Aspen, and find some things that you feel close to your home. If you're in critical care, there's a critical care group. If you're a physician, a nurse, a dietitian, you might be more comfortable starting with your own group. And there are all these opportunities highlighted nicely. And then go to the volunteer section. There are opportunities to volunteer for certain aspects of the organization once you begin to understand them. The last thing is, the sky is the limit based on your personal endeavor. But our Aspen staff are a wonderful resource. You reach out to them, put in a question, and they know the entire spectrum of what's available, and they will slot you into specific areas. When I remember my first ever phone call to Aspen, Jay, was a couple of decades ago now, and I called and I said, "Look, I'm looking for help. I'm a critical care physician, and it sounds to me like nutrition in pediatric critical illness is really a gap, and I'd love to look into what's going on. And can you guide me to someone who's compiled a set of guidelines for Aspen?" And I remember the response I got was, "You come to the right place. And I think, why don't you start the guidelines process and put together a group, because you're right, there is an requirement." And the first set of guidelines were born out of that. It was, and it's then gone into a third iteration now. So as you know, so it's all of these things. There is the organization reaching out to you actively. So just join, and you will find these people reaching out. There's the staff that can guide you. And then there is this your independent endeavor to start looking in. And I know you, Dr. Patel, has done amazing stuff, exactly most of it on your enterprise, and coming forward and saying, this we could do. The last thing I'd say is, if you're fortunate that you already have a mentor who's been at Aspen sometime, or you have any way to reach out to any of the Aspen members who are senior, you really don't need a formal setting. You reach out to any one of these people, our board of advisors, our past presidents, our senior Aspen leaders, such as yourself. We will be more than happy to reach out. So there's, once again, I would say, the thought of joining Aspen is the first hurdle, and then the rest follows.
Yeah, no, that was a wonderful story. There's so much to be gained from, making a simple phone call and really nothing to be lost. And so that is phenomenal. We really appreciate your words of wisdom, and we thank you, for all of your contributions to the organizations. I would like to thank Dr. Mehta for joining us. I would also like to thank Aspen for their partnership for this forum. Dr. Mehta, thank you once again for joining us today. Your words of wisdom will resonate with many individuals. Thank you.
Dr. Patel, thank you for the opportunity to speak with you. Again, congratulations on your many successes and for all the work that you've done for the organization. And again, from both of us to anyone who's listening, we are available, as we alluded to earlier. Reach out. There's a lot of work to be done. There are a lot of challenges that we still need to overcome. But the interdisciplinary combined nature of what we do at Aspen is the perfect platform to get
Yeah,
there. Thanks again.
thank you. I couldn't agree more. Thank you very much. Bye bye.
Cheers.